I'd like to learn so much about the work that you do, and how is it that you started this work? What motivated you? How are you making an impact?
Co-founder and I, we did some international volunteer work when our daughter went off to college. And in that process, we actually traveled through Cambodia on holiday to see the Angkor Wat temples. And we just fell in love with the people, and we saw the need in the country. And that was really the impetus to start Trailblazer. And so we decided that when we were finished with our other volunteer commitments, that we would go back to Cambodia and really sink our teeth into helping there. And the biggest need was water, and the poverty was just palpable. So that's how it got started. And we moved in January of 2005 to start our projects. And I guess hopefully most people are aware that there is a direct connection between good health and a person's ability to prosper. And in most developing countries, like Cambodia, when children are healthy, they can go to school, parents can go to work. The United Nations even highlights the importance of toilets in supporting better nutrition and improved health. And the lack of access to clean drinking water, sanitation, and good hygiene practices are among the underlying causes of poor nutrition. And we've fully well witnessed that, not even just visiting Cambodia, but of course we've been there 17 years and we continue to see it. They're making progress, but out in the rural areas, they've got a long ways to go. And contaminated water and poor sanitation are linked to transmission of diseases like cholera, diarrhea, dysentery, typhoid, to name a few. An estimated 820,000 people die every year from diarrhea as a result of unsafe drinking water, poor sanitation, and bad hand hygiene. According to the World Health Organization, diarrhea continues to be the second leading cause of death for children in East Asia. And in Cambodia, 1 in 5 of the children aged 5 and under die due to diarrhea. Less than 1 in 3 Cambodians have access to latrines and hand washing facilities in their home, and those facilities and schools are limited. Nearly 70,000 Cambodians' rural population, roughly 6.5 million people, still practice open defecation because they have no other option. It's an issue of 1, providing better water sources and sanitation, and 2, educating the people about the importance of clean water and good hygiene.
So I'd like to understand what was it that motivated you to work for this cause?
As I mentioned, the lack of water and sanitation, it's one of the biggest issues of the health across Cambodia for children and particularly rural families. What we noticed is they don't have access to the basic needs. They don't have access to clean water. They don't have access to toilets. And I guess for us, we had good jobs, but we just wanted to do something that was more rewarding, that would really help people on a bigger impact. And it doesn't take a lot of money. And we're helping thousands of people every year get access to clean water, clean drinking water, more abundant water every year. And I just can't imagine doing anything differently.
Now I'd like to jump right in on the actual work you do. So what is it that really your organization Trailblazer does, and in terms of the programs you run in Cambodia? So let's know about them.
Sure. We have 4 programs. Our health program is our largest and major program, where we build and distribute bio-sand water filters. We have a well drilling team, so we drill wells to give people more year-round access to better water, because otherwise they're drinking from contaminated traditional pit wells or ponds. And then we also build latrines, so people have a more sanitary, dignified place in which to go toilet, because otherwise they're going out in the bush, maybe walking 600 or 700 meters from their home. Then our second program is food security. So we are teaching farmers about better practices and techniques to just better feed their families so they can better grow produce out of their home gardens. So we do have a few larger scale projects in that area, which actually then flows into our economic development program. We have farmer community groups that we're starting. We've started our 4th chicken farm, so they have like 500 chickens to really start a big for the market, and bigger income. And then we also have our education program where we have built 9 or 10 government school buildings, 3 libraries, but we also distribute then bicycles and school uniforms to help kids stay in school. So those are our 4 program areas, but the biggest one is health. We're dealing with people in the rural areas that they have no electricity, they have no running water, and then their water supply is limited to the monsoon season. So you got to have water first, and once people have water, then other development just naturally starts to happen, which is really exciting to see.
So my first part of the question is to understand the challenges you faced in the present with respect to the pandemic. And my second part of the question kind of goes back to your beginning, wherein how was the transition like for you to move to another country where the cultural difference would have been vast? So how did you tackle these 2 challenges, one at the beginning and now at present?
Well, I think because of the other international volunteer work we did, we learned things that worked and that didn't work when you're dealing with rural development. And so we knew that in order to do it right, we really needed to work with the government. And so we do. We first established a relationship with the government, and we work with them in their development process. So we are told by the government what the villagers' needs are and where. So that's where we find out the areas that need filters or need wells or need livestock or latrines or a number of things. And so we sign agreements to do that work based on funding. But I think the big key thing is especially when you're starting out with a nonprofit on the ground, you got to be there. You can't just come for a couple of weeks. I mean, it took 6 months for us to get our agreements with the government to do our work, to get permission there. But then the next step, because we don't speak the language, is we needed to find a local director, local staff. And so that was really key. It started very, very slow and slowly evolved. And now we've got a staff of 13 people. They're all Indigenous Cambodian staff. I have a wonderful director, Mr. Ratanak. And so they really are the ones implementing the work. They're the ones going to the government offices, finding out the work that needs to get done. And then they tell us that. And then on the US side, it's our responsibility to find the funding to get it done and to, help set the goals. So in that respect, it wasn't necessarily a challenge of kind of knowing what to do. It was logistically just, accomplishing it. As far as now and with the pandemic, we really were very fortunate that it didn't impact our work that much. We are already social distancing for the greater part by just going to individual families and installing a filter or drilling a well. So that was fairly easy. It didn't really stop the flow of our operations too much. As the pandemic got a little worse, there were some lockdowns to prevent the spread. And that, at times for a week or 2, would prevent us from going into certain areas. And I think still with the social distancing protocols, we need to minimize the number of participants in our agriculture training courses. But other than that, our staff, they've been vaccinated. They're doing all they can to remain safe and protected. And when they do go out into the countryside, they're wearing masks and keeping their distance. And so, like I say, we've really been fortunate that our work has continued for the greater part through all of this pandemic.
Additionally, I'd like to understand that in this whole journey, like 6-year journey of yours specifically here, what are a few things that you wish people knew about sanitation and hygiene that would make the lives of people who unfortunately have to live in such circumstances with poor hygiene conditions?
Well, in the areas where we work in Cambodia, like I said, it's very rural. And when they go out to the bush to go to the bathroom, it really concerns the parents, especially for their girls, the children at night. So a lot of times they have to accompany them. But without a latrine, they have no other option but to go out in the bush. And they don't use toilet paper. So they carry a can of water with them, and they're using that in their hand, to clean themselves. But I think the one thing, a lot of the folks that we're dealing with are 80 to 90% illiterate, even in their own language, Khmer. So when we do our trainings, we have to use a lot of pictures and that sort of thing. And they don't understand the connection between their environment and what they do or don't do and how that impacts their health, because they haven't had that kind of education in the schools or anything. And so that is, I think, kind of a big challenge, is just, educating them on, you've gone out into the bush and you didn't come back and wash your hands with soap, and now that's why you're sick and you have diarrhea, or you've got this bad water and you boiled it, but you're still drinking it. And like even our water filters, we found out years ago that they would take the bucket of the source water to put it into the filter, but then they'd use that same bucket to catch the filtered water. So they were recontaminating their water. So that was a lesson learned. So we started providing a proper storage container along with the water filter, so they would have, that keep their filtered water clean. And those are the lessons learned in development. But I guess that's one thing about in the rural areas and people in developing countries.
I'm sure there are people like me and a lot of young folks who would like to help your nonprofit. So what are some ways that they can help?
Either they could help with some fundraising, do peer-to-peer campaigns, Facebook campaigns. There's a number of, I'm sure, different ones out there, or make a donation themselves. It's coming around, World Toilet Day. Maybe there's holidays coming up, maybe birthdays, this sort of thing. They could make a donation for $175. They could have a latrine built for a family. Most family sizes are 5 people, so that breaks out to $35 a person. And they could have a safe, private, hygienic place to go to the bathroom indefinitely. So that's really not a lot of money to help a family's health and their sanitary conditions. We have a goal of a minimum of 100 latrines a year that we'd like to see built. Of course, that depends on funding. The list that we've received from the government needs list is long. There's thousands of latrine requests, even in just the areas we work. So it is a huge need out there in the rural areas. And they can help really with just being able to fund to supply those latrines.
At last, I'd like for you to leave a message for people watching this video.
I guess don't underestimate the impact that you can make. It doesn't take a lot of money. It all adds up. And whether you can physically come over when the country's back open and help with our health program by volunteering, or you can raise funds on this side. Just don't underestimate what you can do. You really can make an impact. And I would just encourage you, if you ever do get to go abroad and volunteer somewhere, to just be flexible, be patient, be understanding, because things won't happen the way that you think that they might or that they should, and just really try to absorb and enjoy where you are and who you're with, because there's so much to be learned from other people in other countries.